So we're going to talk about mind now. Mind can really include lots of different symptoms. So in this video, we're going to be talking about rage, anxiety, OCD, depression, those types of things that you typically think of with mind. But we're also going to talk about memory, cognitive function, and any sort of reading or writing changes, behavioral delays and regressions, things like that. And so again, this is the focus on the observing of all of these symptoms and how to report the details around them. So Dr. Petersons, why don't you go ahead and get started with some like general advice about mind symptoms?
Yeah, I think the most important part about the mind section is to just give us a lot of juicy examples with as much detail as possible into the picture, like we're there and experiencing whatever the emotion or mind symptom may be. We want to hear lots of examples. So I think that really helps the most. And then from there, we'll give you a lot of examples and details.
And when Dr. Peterson says examples, she means specific stories. So not examples in general, like this might happen and then this might happen and this might happen. She means very specific stories. So my kid got angry yesterday because he was told he had to get off of his iPad, and then his face got bright red and he smashed the iPad and he tore all the pillows off the couch and he screamed and ran to his room. And it took about 20 seconds for him to get to that level of intensity. And then after about 3 minutes in his room, he calmed down and came out and was fine and was remorseful. So that is type of specific story and not just like an example of maybe this would happen, maybe this would happen.
Exactly. And I feel like one of the symptoms that often gets kind of thrown out there is anxiety. There's anxiety, but anxiety is very vague unless we understand the situation that it's around. So giving us robust examples of when anxiety happens. So anxiety at night before school, anticipating seeing all of his friends the next day. And when he's talking about it, he won't stop rambling and he starts sweating, and he looks for consolation and reassurance, and that helps, right? So being as detailed as possible with those emotions, because rage and anxiety aren't very detailed.
Right. And same is true with depression. Depression can be actually quite difficult to describe. And so this is where we oftentimes need symptoms around the depression. So in one of the other videos, the basics video or the modalities video, we talked about how having symptoms that come and go together. So if you notice that somebody happens to always have diarrhea when they are more depressed, that is more useful than just saying that they're depressed. Any physical sensations that can come with depression can be really useful, and things like that. So looking around the totality of the person rather than just looking at the specific symptom that you're concerned about, because the specific symptom might not actually be that useful.
Yeah, and we use those other things to help, triangulate. So, any one symptom isn't very helpful, but lots of symptoms that go together tell a story.
And one of the things that can get really challenging in the mind area is making assumptions, right? Especially when you're talking about your kiddos. I can't tell you how many times we've seen people who say, well, I think my kid is anxious because they're doing this thing. And what the thing is actually a tic, like they're chewing their nails. Chewing their nails doesn't necessarily mean somebody is anxious. And so if you have a verbal child, asking your child what's going on might be the most helpful. And if you aren't able to get that information from your child, or your child's just not willing to talk to you, it might be good to help prepare them that they might need to talk to the provider so that the provider can do the best that they can to get information. Because the reality is, especially when we're dealing with tweens and teens, we might see an outward expression of something like rage, and actually what's going on is it's being driven by anxiety or depression, but we might not actually know that because we see an outward expression. And both of those things together is part of that triangulation. So knowing that depression is causing rage, or depression is causing, or anxiety is causing rage, is actually far more beneficial than just the symptoms that we can see with the rage.
Yeah, and not assuming that because we feel one way about something that is the way our child feels, or that because XYZ happened to them, I think this is why these symptoms are here. I think it's really important that we hear from kiddo that they really ruminate on an old event that happened, and that really is what they're, you know, depressed about, and that it isn't something else, and that we haven't kind of projected that onto them.
Okay. And in our last minute or so here, we wanted to touch briefly on cognitive dysfunction and memory, because that's another one that can be hard to describe. We're not always going to have all of the modalities around it, though you might be surprised that there could be memory is fine or cognitive function is fine until the sun is setting, or memory is fine in a cold room, but not in a hot room. Cognitive function doesn't work well in a hot room. So those types of things could make a difference. Mental exertion can make a difference. Is it the slightest mental exertion causes physical symptoms as well? So there is that overlapping connection. What else can you share about cognitive function, Dr. Petersons?
Yeah, and making sure we differentiate between reading and writing and reading out loud versus reading to themselves, and you know, being, what are they actually having trouble in? You know, is it just math, or is it reading and writing? Are they mixing up their words? Are they, you know, writing really large?
When speaking, are they forgetting words? Are they using the wrong words? Or are they just losing their train of thought in the middle of something, like, you know, losing words, that kind of thing too. All right, we will talk next about neurological systems. So things related to tics and involuntary movements. So we'll see you on that next video.